Hello, welcome to Info Hub Extended. Every year, regional health officers are afforded a forum where they highlight challenges, successes, and other reports from their regions. Looking back on the year 2017, there were many successes to boast of and acknowledgement of areas that need to be filled. Collaboratively, we build a resilient healthcare system that is acceptable, accessible, timely, and appropriate to meet the needs of every person in Guyana. This is the overarching theme guiding all RHO's meeting. This vision-inspired theme now pushes for a data-driven approach towards desired outcomes.
This year, the Regional Health Officers meeting was held at Lake Mainstay from July 4 to 6. Health officers from all regions attended the meeting. Medical superintendents, senior doctors, and other regional officials were also invited. These meetings are coordinated to address a number of issues which exist in the healthcare system while seeking to design new methods to prevent further recurrences. Minister within the Ministry of Public Health, Dr. Karen Cummings, commended the Regional Health Services Department of the Ministry for hosting such an event. It was noted that these encourage openness among health staff and serve as a platform to engage with government ministers and RDC heads in improving regional healthcare systems.
This special time is being set aside to introspect and develop efficient and effective ways of refining the way healthcare and healthcare services will be offered in the future throughout our regions is as opportune as it is essential.
Delivering the opening remarks, Director of Regional and Clinical Health Services, Dr. K. Sheko, said the forum's purpose has been embraced over the years. The discussions facilitated here have contributed to major changes in the health sector.
Let me just briefly tell you that the healthcare system is not perfect, but it is better than before. You will agree with me that we have cross-cutting issues like human resource, our referrals and counter-referrals, our downtime when it comes to biomedical repairs of equipment, also our drugs and medical supplies, and those are just to name a few. But we have been making strides.
While some solutions are sustained, Dr. Sheko noted the RHOs remain critical to efficient and effective health services. She pinpointed the effectiveness of solutions, new programs and initiatives to the commitment of RHOs to their job. Further, she pointed out the RHO's responsibility of managing a region's health sector is of critical importance.
I want our RHOs to understand that they are stewards of the region. You are placed in a position of responsibility. What is a steward? A steward is an official that supervises arrangements or keep order. RHOs, do not neglect your duties. You are to communicate. I know you have a dual communication process. That dual process is both to the Regional Democratic Council as well as the Ministry of Public Health. If you report to the Regional Democratic Council, you're supposed to report to the Ministry of Public Health at the same time. RHOs, you need to have respect for your position. Respect for your position. You cannot be an RHO and you're drunk on the job. You cannot be an RHO and you're smoking on the job. You cannot be an RHO and you do not have respect for yourself, the way how you look, your decor.
Minister Ronald Bulkin noted that the Ministry of Communities' vision to develop sustainable living spaces and neighbourhoods has been tied to the Ministry of Public Health's vision to provide optimum health care. Therefore, he too placed a heavy emphasis on RHOs managing their sectors well.
Governance and leadership is the first of the 6 pillars of the World Health Organization's systems framework. Whilst the ministry does support the call for RHOs, who are primary clinicians, to be equipped with health managerial skills, there is still the need for effective oversight and monitoring by local organs to ensure the satisfactory delivery of health services to their constituents. This administration has resolutely and strategically embraced, as I said, the principle of decentralization. This form of governance dictates that decisions and solutions to issues are locally derived and implemented. It is about people's empowerment and the building of the capacities of local institutions to deliver effective and efficient public services. It is accepted that Guyana is too large to be either effectively or efficiently managed from the center. Hence, the regional system was created in the 1980s with the primary objective of accelerating the rate of development by facilitating prompt decision-making, effective coordination of program and activities, and greater involvement of the people at all levels.
Minister Bulkin further said it is now high on the agenda of both ministries to continue to embark on efforts that will bridge the divide in healthcare services and its delivery.
This administration is serious about its commitment to bridging the gap between the quality of services provided on the coastland and those provided in hinterland. I wish to echo the sentiment of His Excellency President Granger, where he stated, and I quote, "We want to ensure that we understand that Guyana is not two nations, one on the coastland and one on the hinterland. We want to bring those two parts together so that the quality of life and the standard of living on the coastland is the same as the standard of living in the hinterland, or the other way around. The standard of living in the hinterland is the same as it is on the coastland." End of quote. There is no denying that currently a gap exists between the quality of healthcare services provided in the hinterland regions and that of the coastland. But we are working to close this gap. We have heard of efforts in this regard already. Hinterland RHOs, therefore, need to be more innovative and to work even harder to assist in bridging this divide.
During the first day of the meeting, Minister Bulkin made himself available to listen to each of the regional presentations. He had specific interest in the challenges and constraints experienced, especially in the hinterland health sectors.
During the remaining days, RHOs met amongst themselves and examined various indicators to address existing challenges in the regions. From these discussions, several solutions were designed. Most regions looked in the direction of adopting best practices that will improve service to the region's health services.
The first indicator looked at the number of trained healthcare workers recruited and their placement in the regions. Regional representatives were grouped and put to discuss effective ways of employing and staffing facilities. Outcomes of these discussions highlighted areas pertaining to human resource management which need to be urgently addressed.
An essential HR system for a primary healthcare level facility should have the following: a family care doctor, a doctor in charge, midwives, nurses. We should have at each primary healthcare settings a pharmacy technician at least, if not a pharmacist. We should have at all these healthcare settings counselors, psychologists, social workers, and last but not least, community health workers, DOTs, and field workers.
Mental health training for all staff working in healthcare to include both staff and patients. We basically wanted to provide an avenue for staff to be able to address stress factors that are part of the job. And of course, we need to improve the overall health outcomes in patients. So in terms of the mental health training, it's not just for the patients, but also for the healthcare workers to better do their jobs. The next priority, we thought, increase the community health workers force in terms of the number of training sessions, the number of persons who are trained in community health work. We thought that we needed a bigger workforce in this area in order to have more interface between the healthcare professionals and also the populace, so they can make more informed decisions. They're more aware of what is possible at the healthcare facility, and of course they feel we might get a greater response in terms of health-seeking behaviors if there's more interaction between the healthcare workers and the population.
Renumeration, by definition, states it's the payment or compensation received for services or employment. This includes the base salary and any bonuses or other economic benefits that the employer executive receives during employment. As it is right now, The remuneration cannot work for us. Our living wages, we're asking if it can be increased, at least on par with our Caribbean countries. We have presently doctors around the 200,000. An intern in Barbados gets 2,000 US a month. A GMO post just your MBBS gets 10,000 US a month. And we're still under 200,000 Guyana dollars per month. We're asking also, can we look at the scaling system, reevaluate or revisit our scaling system at present? As it is right now, when public service is given the increases, we have those who are earning a higher salary having a smaller percentage increase, and vice versa.
Other discussions surrounded improvement to primary health care, especially within smaller programs such as that of dentistry. Meanwhile, the National AIDS Program, NCD's unit and overview of accident and emergency services saw in-depth interaction with the involvement of all regional health officers and other senior doctors attending the meeting. Even as the sessions concluded, RHOs identified areas where they can improve services in their respective regions. Others fostered channels of communication to aid in the efficient delivery of all health services.
This workshop has been quite supportive, especially the indicators that we would have reviewed for the year 2017, and in my case, Region 1, we would have looked at areas in terms of 2018 in terms of the discussions and our graphs, basically using a comparative between the same period, January to June 2017 and January to June 2018. These figures in terms of the main indicators, maternity, the various ratios in terms of the incidence of infectious disease and so forth, they all will be playing an important part in our budget planning phase.
So we've had a vigorous and comprehensive, I would call them lectures here at this retreat in Mainstay. And we, as head directors, RHOs of the region, we have taken or grasped certain key components that are lacking, and that we now possess certain knowledge, information, and we have the basic tool to go about correcting these deficiencies. One major issue we have in Region 6 right now is pharmacy, as it pertains to personnel for the pharmacy department. So we have gotten some sort of initiative from Minister Cummins, how we're going to go about and make the change and advocacy to attract these senior pharmacists to our region.
We've seen a lot of gaps that needs to be filled. For me, what I would take away most from here is what I'm most weak in is the dental department, because as a GMO, government medical officer or doctor, we don't have too much of a knowledge. We're not that au fait with the whole dental system. So hearing Dr. Sullivan's presentation was very enlightening, and what we're going to take away was we're going to liaison with him, meet with him, and we're going to try to improve the dental services in the region.
One of the biggest takeaway I got from this meeting is really getting a key insight to example what are some of the other programs going on within Central Midwifery, just such as the willingness of the dental department and the openness of the chronic non-communicable disease department, and how we could collaborate to strengthen our programs back at Demerara Mahiko.
In her closing remarks, Junior Minister Dr. Karen Cummins reiterated points of greater collaboration with partners. She explained that there is only one responsibility of the Ministry of Public Health through the Regional Health Services Department, and that is to ensure every person everywhere in Guyana has access to health care.
As I mentioned in my previous remarks, RHS is the nerve center of the Ministry of Public Health. It is through the RHS department that public health care is delivered in every region. Therefore, it is imperative that each officer in the department in respective regions recognizes that he or she has a major responsibility to provide optimum service to each person in the region who requires health care. The ministry operates in the service to the people of Guyana. I urge that each of you rally your charges, and together let us do our utmost to deliver the best quality public health care we possibly can.
Regional health officers' meetings of this scale are held annually, while smaller gatherings are facilitated in the form of capacity-building workshops. These meetings serve as training ground and space for guidance, which will help to improve the functions of these officers. You have been watching another edition of InfoHub Extended. Do join us again. Goodbye.